Doctor, what does it cost you to make or remake a retainer? And do you charge for that? All those costs? And still make some money on it because you are in business to make money? The retainer was in my pocket. I leaned on the wall at the game and heard a crack. The retainer fell on the floor, and when I leaned over to get it, somebody stepped on it. It wasn't my fault, doctor. My retainer's in the Pacific Ocean. How do you know that? Well, it was under my cap, and my cap blew off my head, and the retainer and the cap were in the ocean. We couldn't get to them. What the heck was it doing in your cap, on your head, on a boat? Well, okay. And then I say, you know what? Let's just make you a new one. Now let's talk about the costs here. Operatory setup, sterilization, instrumentation, cleanup, and asepsis after the appointment, supplies, the tray if disposable, the impression material, the disinfectant spray, the bands if it's going to be a banded appliance, the lower lingual arch, for example. How about doctor time, your most expensive cost, to evaluate needs, relapse, design, anchorage, and talk to the patient and the parent. Staff time to set up, fit bands, take the impression, work with the patient and parent, answer the questions, disinfect, get it ready for the lab, do the prescription, clean up, asepsis of the operatory. This is all costly. Be smart. Take the best care of the patient, take the least of their time, I'm serious, and yours, serious again, and provide the best chance for stability over the longest time possible. Why? How? Remake. Do not repair retainers. Yes, retainers will break. Yes, retainers will be lost. Yes, retainers will be damaged. I was sitting in class, I heard a little pop, and the wire was broken. Just so they don't think you're quite that gullible, and to give great info, here's what I say. That's almost surely not when it broke. They break it some other time. Sometimes if you chew on it or play with it or take it in and out over time, but when you were sitting in a class and you felt it or heard it not fitting quite the right way because it was broken, okay, let's get another one made, right? Here's the winner, the most frequent story award. I left it on my tray or on the lunch table, and when I went to try to find it, it was gone. Now I'm going to tell you the story of a mom digging in a dumpster behind the school. I'm going to explain to you exactly what she did in just a moment. Okay, so the mom comes in, she's in her sweatsuit, workout togs, and in she comes looking somewhat distressed and excited or kind of hyped out. And I said, "What's going on?" And she said, "Well, I just came from going through the school dumpster over there across the street." Really? You went through the school dumpster? Yes, I was in the dumpster. Okay, I'm ready. Tell me more. Well, my son Trey put the retainer on his lunch tray and threw it away. And we couldn't find it, and we went through all of the trash that was in the cafeteria, but it wasn't there. So they said, maybe it's in the dumpster already because we throw these out pretty frequently. And of course, this is afternoon now. He's home from school. Okay. So off I go to the back of the school, and I start trying to pick up the bags that I can reach, and I think, I can't get to all of them. Fortunately, everything was bagged, so I thought, okay, I'll go through one bag at a time. So I climbed in the dumpster and started the first bag. No luck. Started the second bag. Stuff from trays, food, but I had gloves on. I took gloves with me, and I found it. Dr. Chris, would you sterilize it, please? Yes, ma'am, I will do so. Now, I want you to understand something. In my mind, I'm thinking, we better check to see if it still fits properly, but certainly I'll run it through our gas sterilizer, thank goodness for ethylene oxide sterilization, and I can sterilize the retainer, and then he can come in and I can take a look at it. He's gonna have to go without it overnight, and then I can take a look at the fit and be sure that it still fits, because who knows what pressures and forces and what happened to it in that process. Fortunately, the good news was that the next day when he came in and Mom was fresh now, she had had her shower, she felt so much happier, and it did fit. And fortunately, he had wrapped it in a napkin, which we're going to talk about in a minute. But you know what? It had sort of protected it, I guess, in the dumpster. So if you're going to throw it in a dumpster, okay, and then you wrap it in a napkin. Otherwise, I'm going to show you right now, we're going to go over to the tray table, and I'm going to show you why we never wrap it in a napkin. So we'll go over and take a look at that. We have Johnny here, and Johnny's getting his new retainer. He's so glad to be out of his braces, and here we have his retainer, and we're going to try it in his mouth and explain everything to him. And then I'm going to say, Johnny, this retainer you're going to wear 24/7. That's 24 hours a day. That's 7 days a week, except when you're eating and brushing your teeth. So let's say you're eating. Let's say that you're at school and you have a tray. Or let's say that you're at home and you have no tray. Either way, never put it down on anything except the table surface. Get a napkin or a tissue and lay it there. Take it out of your mouth and lay it on your tissue or your napkin. Why? You will not see it thrown away that way. Somebody's going to see that. Be sure that you leave it open. No wrapping. If you leave it open and you leave it and walk away from it, somebody's going to see it and not throw it away. So A, 24/7, 24 hours a day, 7 days a week. And B, never on a tray, never on a plate, always on the pure table with something under it. Don't worry about somebody saying, that retainer. Say, yeah, that retainer, I'm not going to buy a new one, right? Okay, that's the story, Johnny. Because I want you to understand that remade retainers is a big part of your orthodontic follow-up. This is life. It's just the way it is. And know that it's part of your practice as well. And like everything that you provide for your patients, it's actually part of the income stream because they need it. And you're the man or lady, so there. Charge for it as you should and learn about retainer insurance, by the way, in this course, your new course in retention, because this insurance will please the parents, the patients, and you. And I tell you all about that in the course. Doctor, we look forward to sharing this with you.